Welcome to the By Design radio program. My name is Dr. James Proodian of Proodian Healthcare and ProodianHealthcare.com, where health literacy is the key to longevity. And as long as God has us on this side of eternity, my show is designed to help educate you and your families to feel better, function better, and live as many quality disease-free years as possible. Thanks for joining me this week for show number 50. Yes, we made it to 50. It's a big milestone this week for me as I start the final topic, or I should say the final foundational piece of our 50-week series here on energy/fatigue. So today we're going to be diving into the last foundational subject matter, which is fatigue and why fatigue exists, where it comes from, what we should do about it. And if we remember the pyramid of health, guys, there are 8 pieces of the pyramid of health, which I've blogged about at drproodian.com, and I could send you, so feel free to ask me for it. We have gone through so far detoxification, epigenetics, immune function, inflammation, digestion, structural integrity, stress, and finally fatigue. So the show is designed that in the first year, I would be able to get through the 8 foundational pieces and then use these foundational pieces as references. So you could always go back on tandemradio.com and in the archive shows, and on my YouTube channel, we have all of the shows archived for you to go back to. The shows are between 14 and 17 minutes long, and I'm real excited now to complete fatigue because it'll allow me to refer to foundational shows. And the foundational subject matter is not like we do them when we forget about it. As a matter of fact, the reason I waited to the end to do fatigue is because fatigue encompasses all 8 foundational pieces. So I'm real excited about this. One of my companies, Wellness at Work, which is my public speaking company, fatigue is the #1 requested seminar that I do in corporate America. So I have about 33 seminars that I've written and I administer in corporate America and at schools and various places throughout New Jersey. And fatigue is the #1 most common requested seminar that I deliver. So the reason for that is because so many people could relate with fatigue. It is an absolute epidemic for people over the age of 20, 25, 30 years old, although we see it in children as well. And the reason that we see so much fatigue is what we're first going to go through. Today we're going to take apart, some of the reasons. We're going to be going back a little bit. We're going to be bringing together a lot of the dots that we've been trying to connect over the last 50 weeks. And I really hope and pray that the people listening to me are implementing some of the practical, by design methodology to their life. The way to shop for their food, types of food to buy, how to handle stress, how to avoid stress, what is detoxification. We went through a number of shows on structural integrity and proper types of exercise. And these shows were designed to give light to the very design, physiologically, anatomically, biochemically, to God's design that we should be following. So let's dive in and let's get going with our final foundational piece. Luke 1:37, for with God nothing is impossible. That's the Bible scripture for the show. And I say it every week, nothing is impossible, as with better education and bringing to light some simple tools that we all could utilize to try to live the 100-year lifestyle. Now, what is the 100-year lifestyle? Well, I sat down one day and realized that what I'd like to do is I'd like to feel better, I'd like to function as well as I can, and I'd like to live as many quality disease-free years as possible. Going knee to knee with thousands of patients a year, the one thing that I've never heard a patient say is that they don't want to feel better, they don't want to function well, and they'd rather not live a lot of years, and they'd like to have a lot of diseases and chronic illness during the course of their life. So the 100-year lifestyle, although I can't predict when tragedy and trauma might strike, I can't control that. The things that I can control are the things that I could eat, that's nutritional, the way my emotional and psychological health, my spiritual health, that's that muscle between our ears. We want to take good care of that. And finally, our physical health. So physical, nutritional, and psychological makes up the triad of health, and I want to employ that triad of health every day of my life. So how I exercise, how I eat, and how I temper stress, physical, nutritional, and psychological, will be a major component to my longevity. Okay, so the factors that could affect that triad, yes, are genetic, but we can choose better parents. All right, when Mommy and Daddy Proodian got together in 1965 and had some fun, I started off with a deck of cards. That's my DNA, and so did you. We can affect the epigenetics, which I did shows on, which is separate than the genetics that we've been gifted. So our genetics don't change much, but our environment will have the greatest impact. Our lifestyle habits in our environment will have the greatest impact on our health. So every day as we go out in the world, we're exposed to a certain type of environment. Sometimes it's polluted. Every day we're maybe not getting enough sleep and rest. We're under stress. We have lack of fitness, so we're not doing the right type of exercise program. We have poor posture, or we're consuming, high calorie, high fatty, processed, man-made food, the stuff that God did not intend us to eat. So all of these things are potential resistance reducers and fatigue, in basically bringing upon a great amount of fatigue. So our environment, lack of sleep and rest, stress, fatigue, posture, and the fuel that we're consuming, all of these can produce fatigue in one's health. And our health, and the way in which the health is defined, is a complete state of emotional, physical, social, mental, and spiritual well-being, and not merely the absence of disease. So the definition of health is not, hey, I feel good, therefore I must be okay. That's not true. Okay, we want a complete state of health that we were designed to have by nurturing and taking care of our physical, our nutritional, and our psychological health. So as we look at the chronic illness that we're all paying for in this country, and right now in 2011 compared to 2029, we're looking at a chronic illness cost to go up by $47 trillion from 2011 to 2029. So in 20 years, guys, within that 20-year span, chronic illness is expected to cost our country $47 trillion more than it is right now. And a large percentage of that is highly preventable, which means we can't blame Mommy and Daddy Proodian for giving us a genetic code. A very small percentage of this is actual genetics. Our lifestyle greatly produces this chronic disease, like type 2 diabetes, like heart disease, cancer, high blood pressure, osteoporosis, a whole host of the chronic illness that we're spending our money on. So what we're here to do is to learn, to teach what are the practical applications of, let's say, the pyramid of health. And then one of those rungs on the pyramid is this fatigue or energy. And fatigue is the most common complaint presented to primary healthcare providers. So when you go to your doctor's office, or I go to my doctor's office, we have to fill out a form. And it asks us, what's wrong with us? The box that's checked off the most across our country is fatigue, lack of energy. Yet physicians tend to know very little about fatigue or how it should be treated. It's a very complicated thing. Fatigue could have many sources. And to be honest with you, when you look at your medical providers and you look at the way hospitals and ERs are run, they're there to save our lives. They're there to detect disease. But if you think about something like fatigue, not necessarily the most intriguing thing to most of our medical providers that we have fatigue. It's many times a byproduct of something going on in our lifestyle. So you have to ask yourself, what would your day be like if you had more physical and mental energy? What would your life be like? How would it be different? The process of fatigue, or the actual definition of fatigue, let's define it. It's a state of increased discomfort and decreased efficiency resulting from prolonged or excessive exertion, loss of power, for instance. So fatigue is going on year in and year out. It's a state of increased discomfort and decreased efficiency from a prolonged excessive exertion. So as we go through our lives and we think about in our teenage years, we maybe go off to college, and in college we have bad sleeping habits, or in our 20s we have bad sleeping habits. We're going out, maybe not living the best lifestyle. For those who drink alcohol or get, working out too much in the gym, and fatiguing their body. They get away with it in their 20s because we have other energy sources. Then what happens? We get married, we have children, we have jobs, and this 20s and 30s and 40s, we're running on this treadmill of life, using up our energy storage, and we end up on the couch many times, 50, 60 pounds overweight, feeling lousy, and 2 o'clock, 1 o'clock in the afternoon, we're all drained up, drinking, 32 ounces of coffee a day, and we even wake up tired. And that's a clear sign of having fatigue, is waking up not refreshed, but waking up tired. So let's continue. Let's continue with the 8 things that we're going to take apart over the next couple of weeks. What causes fatigue? Okay, so if you have paper and pencil, you can write these down. If not, if you want me to send them to you, I will. Just email me at proodianhealthcare.com is the website address, and there's a link there that says submit a question. So feel free to submit a question. What causes fatigue? Number 1, disease. Number 2, lack of sleep or sleep disturbance. Number 3, adrenal burnout, which we discussed during our stress seminars. Number 4, drugs. Now, I don't mean heroin, cocaine. I mean things like caffeine, alcohol, and nicotine. Yes, these are drugs. So, number 5, gastrointestinal dysfunction. That's the way we're digesting our food. Number 6, deconditioning. Number 7, poor nutrition. And number 8, prescription medication. Now, if you've been following my show, you probably picked up in there, hey, he talked about sleep. He talked about adrenal burnout. He talked about the gastrointestinal tract. He talked about deconditioning. He talked about poor nutrition already. Yes, I did. Because all of those things, are tied together and directly related to fatigue. And fatigue is nasty. I mean, we've all been there. I have 5 children. I remember the days, my youngest is now 4.5, so my wife and I aren't really in this anymore. But the days of those sleepless nights with the baby crying, and another one who has a fever, and it still happens. I mean, when we go through sleepless nights, or maybe only catching a few hours of sleep a night, we know what the feeling of fatigue is. And I could tell you, I remember staying up 2-3 nights in a row studying for finals when I was in college, and I was able to deal with it when I was 22 years old. Well, at 45, 47 years old, it's no longer I have the ability to do it. Our bodies require sleep, and that's one of the 8 things that we're going to be talking about. So let's open, with the fact that we've got a couple of them. Let's just get these off the table. Number 1, disease. Disease causes fatigue. Now, no one who's listening to me should be self-diagnosing disease. You should go to your medical doctor, complain to the fact that you're having fatigue, and there are some blood tests that need to be run, along with a physical examination, to rule out things like chronic fatigue syndrome, fibromyalgia, thyroid disease, depression, anemia. All of those things cause fatigue. Now, those are medical situations. Those are things where you go to your doctor and you want to, check them off and make sure we don't have those types of things. But the other types of things that doctors should be looking for, and many times they're not, and you may not realize that these things cause fatigue, is chronic pain and infection and inflammation. A swollen ankle could cause fatigue. Low back pain, yeast infections, arthritis, colitis, allergies. I know that right now I'm a little bit into allergy season. And for those of you, seasonal allergy people out there, you know what it feels like. That by 3, 4, 5 o'clock in the afternoon, I am tired from dealing with my seasonal allergy. And so these are the types of things where we want to make sure that we know what the diagnosis is, we know what we're dealing with, and we're not doing something for let's say a person has thyroid disease and they don't realize they have thyroid disease. That would be very dangerous. So make sure we start with a physical exam with our medical doctor that includes thorough blood testing. And I can't emphasize the word thorough enough. If you're going to run bloods thinking that we want to look for inflammation, let's make sure there's a HSCRP on that blood report that's high sensitive C-reactive protein. Ask your doctor for it. If you're thinking maybe anemia, yes, of course, on a CBC chemistry, we want to make sure that we're looking at the chemistry and looking at our iron storage to see what kind of anemia maybe the patient has. Not all anemia is treated with iron. Remember that. Okay, anemia is a bit complicated. Talk to your doctors. Depression, absolutely something we should be diagnosed for if we're dealing with that. Fibromyalgia, a bit complicated of a disorder to diagnose, many times misdiagnosed, underdiagnosed, overdiagnosed. Oh my goodness. So that's another one. And chronic fatigue syndrome, once again, you got to go to history, examination, and blood testing on that. All right, so we do our doctor thing. We get the diseases on or off the table, and then we have to look at point number 2 of our 8, which is prescription medication. You want to ask your doctor whether or not your prescription meds could be causing fatigue. If you could do that, or also, hey, there's such a thing as Google nowadays. You have Physician's Desk reference. The PDR is now an excellent source, or there's plenty of web browsers where you could look up the medication that you're taking and see if the medication you're taking is a cause of fatigue. Many times, medication combined with other medication could cause fatigue. Medication combined with certain herbs, which is why you've heard me say do not go on herbals unless you know it's coming from someone who does herbal medicine. So what we're looking at there is go take a look at the medications you're taking, talk to your doctor about certain diseases, and those are the first 2 of the 8 causes of fatigue. And as we end today's show, next week we'll pick up on cause number 3, and we're going to go through 3 through 8, and we'll conclude over the next couple of weeks on fatigue. Thank you for listening to the By Design radio program and joining me, Dr. James Proodian, for this episode. If you'd like more information on Proodian Healthcare, please go to ProodianHealthcare.com, and that's spelled Proodian as in Nancy, healthcare.com, and please feel free to submit any questions you have for the show. Thank you for listening to me. God bless you and your families, and have a blessed week.